We hand over to Peter to give us guiding questions, and we expect that we shall have had enough participants in the room for us to go into the breakout session with the guiding questions, quickly get feedback, and we come back with the groups reporting, and we have Professor Maina giving us some practice and issues that should have come from there. Then we have also the summary. The rapporteurs definitely would have presented. Then we have a summary and by Professor Maina on this engagement, then concluding remarks by again FAO and AFAS. Then we get on like that. So I think the group is here, we are here, although we are trying to buy time for some of the participants to join. Some probably could have got lost along the number of rooms that we shared, but we hope they can catch up with us. So I want to handle this political part before I hand over to Peter by taking this very humble opportunity to invite Dr. Slim, the ED of AFAS, to give us few opening remarks and words of wisdom in context of integrating nutrition in extension. So, Dr. Slim, you're welcome. Meanwhile, we shall be introducing ourselves in the chat so that we really know who is in the room and how we can interact. So over to you, Dr. Slim.
Well, yeah, I can get it now. Yeah, thanks very much, Max and Peter, for facilitating this very important meeting. First and foremost, let me thank the FAO for providing resources and also initiating this initiative, and also thanking KEPHAS for the good implementation, and of course GIFRAS for participation, and all the other panelists who have been cited. Is Professor Richard Miro, Suleiman Rashid for really dedicating himself in the design, and also others who are participating, Edith, Catherine, and so on. And of course, the FAO team, I don't know if they're already there. There's Anne, there's Deji, and Joel, and so on. Thank all of you, really. Well, first and foremost, nutrition really is a global problem now. It's a global challenge. And in Africa, it is more problematic, and this is mostly because this is compounded and exacerbated by issues of climate change. We know there's climate change, so the food system is changing, and there is of course increased population. So with increased population, there's even less food, even generally. There's the issue of there's increased commercialization. And mostly this is dictated by migration to the urban centers and so on. So basically, the problem is really serious now in the continent, but of course, it's a global issues as well. And yet, as we all know, cultural extension advisory services are ill-equipped to address this challenge and provide services which focuses on nutrition. And of course, as we know, nutrition really affects everything. Especially it starts from child growth. And once these affected child growth and child development, then we are in trouble in terms of child development and as we grow older in all kinds of issues. So focusing on this initiative, we want to thank those who participated in this, especially this initiative. And even the past initiative, I can see Malawi is there, Cote d'Ivoire is there. And therefore, I can see this as a beginning of scaling up what we think is a very serious problem. And this needs assessment, therefore, is a good starting point, and will form a good learning platform, especially when we combine with Malawi and Cote d'Ivoire, out of who are probably moving to implementation. And when we look at it, this assessment certainly will probably is not the beginning. It is going to expand. We have to expand its scope, and its scope will have to include the issue of putting in a community of practice, and then the issue of involving more countries in the initiative. And when I'm talking of the initiative, it is not only on the needs assessment, but also in implementation as well. And then, of course, collaborating with other partners, both at a national level, continental level, and global level. And we of course, the whole aspect of nutrition has to be institutionalized at national level. And therefore, the methodology we are talking about is very instrumental at the beginning, but also it has to follow up with the requisite capacity development for extension, as well as the implementation and the issue of institutionalization at national level. So basically, let me again to thank all of you and for this very important initiative. And we hope and pray that this is just the beginning, and we'll be rolling it out and scaling it up, and involving other aspects of nutrition, such as the ones I've mentioned, the issue of implementation, institutionalization, and developing broader partnerships. So again, let me thank you, and really pray that this meeting is opened and the discussions become very fruitful, and for the benefit of extension workers, but also the continental level stakeholders. Thank you very much.
Thank you so very much, Edie, for those opening remarks, the words of wisdom and encouragement, and also the direction to which extension should really be focusing in terms of the nutrition, but most important, ensuring that institutionalization, sustainability, and engagement take place. So it is our honor to invite the chair of CAREFAS. In the Zoom, we say the representation by one of the board members, Mama Mary Kamau, who is also, whom we should request to give her opening remarks as chair, but also give her perspective in terms of agriculture extension in a nutshell, so that we all we finish those two together. Mama, welcome. Karibu sana.
Thank you very much, Bwana Max, the ED, our panel members, and everybody else. All protocols observed. Jambo. Can you hear me?
Jambo sana.
Yes,
Mama.
we can.
Jambo sana.
Jambo.
Yeah, I would like to take this opportunity to welcome all of you on behalf of the chair, CAREFAS, in this very important workshop or webinar, where we are discussing the issues of nutrition in extension. In CAREFAS, we are on board as far as trying to revitalize extension services in the country, because you do know that after devolution in 2012, a lot of the gains that we had made in extension services provision, they actually did not continue very well, but we are on board trying to revitalize and see what we can do as far as the issue of extension is concerned.
Mama, they've requested me to request that you could put your video on. When Dr. Slim is also closing later, he will have to do the same, although he's a very popular person already. Thank you, Mama.
Thank you very much. I was just welcoming you on behalf of the chair of KEFAS, maybe who could not be with us this afternoon. And I was saying, as KEFAS, we are on board trying to revitalize the extension in the country. As you may be aware, in 2012, we devolved our extension into the county government, and it is being led by the very many counties. There are about 47 of them. And then the transition had not been very easy, and we had not actually translated well so that we can be able to have continuous extension provision as we had before. As for now, we are trying to bring on board a policy on professionalization of extension services, and also trying to streamline the NASCEP policy, which we had already done before devolution took place, so that we can be able to align it with whatever is happening on the ground at the moment. But all in all, KEFAS is doing well, and we are trying to advocate for the farmers' provision of, the recipient of extension services provision. That one notwithstanding, I would like also to take this opportunity to say something about extension and nutrition in general. As you may all be aware, extension is meant to transfer information, knowledge, and technology to the farmers or the farming community or stakeholders, so that we can be able to realize agricultural development and transformation in our countries, in our region, and in the world at large, so that we can be able to ensure that we have food and nutrition security in all our areas. Needless to say, effective and efficient agriculture and advisory services is paramount for food security and nutrition. And it has been going on for most of the countries for a long time. We do know that in our regions, extension has been there for a long period of time, over 60 years, if I can talk of where we have in Kenya. And we have seen a lot of transformation of agriculture extension and provision. And where we are at the moment, as much as initially we were focusing on providing technology so that you can improve productivity and production, extension has gone a little notch higher, because we see that if we can just give information to the farmers and they improve their productivity and production, what happens to the post-harvest challenges that we experience in most of the areas? What happens to the issue of maybe marketing, which has become very pertinent in most of the areas and in most of the countries? What about food distribution? Like now in Kenya, we are talking of food insecurity in most of in about 7 counties in our country, affecting about 3 million people. And this figure has been on and off for many, many years. We've been talking of food insecurity in some of these arid and semi-arid lands. And you find still in the same Kenya, we have some areas where we have more food, and especially in the central region where we have more info. So you'll find that because of the food distribution, we can have food insecurity and nutrition insecurity in some areas. As far as extension, these are the areas actually we should focus. As much as we focus on production, productivity, we should look into a notch higher value chain development, so that we can be able to look at agriculture more of a business than a subsistence provision for most of the times. Demand-driven extension is the way to go. Involving everybody, partnership, so that we can be able to move extension in a holistic way is necessary. We need to bring private sector so that they can be able to come on board, so that whenever we tell the farmers to do extension, improve their productivity, the private sector will come on board so that we can assist in marketing, value addition, and increasing the farmers' income. As far as the nutrition is concerned, there has been maybe extension, provision, or methodologies to improve nutrition, because I remember like when we were working in the ministry, we could have partnership with even the Ministry of Health, where we could be able to tell or inform the farmers and the farming clientele to improve the nutrition capacity, both at the farm level and at the industrial level. Because you find nowadays, you can find so many entrepreneurs who are coming to do food fortifying so that they can improve on nutrition. It's now easy to see cassava flour, sweet potato flour, pumpkin flour in our shelves in the supermarkets. And this will improve the nutrition of those who are buying this product. So I think all what we should do now is to intensify this extension provision as far as nutrition is concerned. And we cannot do that without coming up with policies. We have to have extension policies which actually focus in our food systems and also in our nutrition system. Because without that, we can be lost. They normally say, if you don't know where you are going, it doesn't matter the route you take. So we should have policies which will be intertwined with the agricultural policies that we have in our countries and in our region, so that we can be able to mitigate food security and nutrition security at the same time. And in general, extension and the farmers and the farming clientele need to be empowered so that they can be able to make sure that whatever the messages they get, they can implement them. If we don't empower the farmers, if we don't empower extension providers so that they can be able to give this knowledge to the farming community, we may lose out. So empower the farmers, give them the credits, give them the inputs, so that or access them the input at affordable prices so that they can be able to uptake this knowledge and innovation. And we can have advocacy so that the governments that we are dealing with make sure they have enabling environment for agriculture to take root and to be effective. Because if we don't have enabling environment, we can give all the technology, all innovation and research, and even train from different societies, all institutions, but nothing will happen. So we need to empower our farmers. We need to empower our extension providers with the information so that they can be able to reach wherever they are supposed to reach, so that we can have not only food security, but nutrition security. Thank you, and God bless you all, and have a very, very rich meeting. Thank you.
Thank you so much, Mama, and thank you for those very articulate words, very insightful. Would now like to move straight away and request Dr. Miro to share a few insights in terms of nutrition agriculture nexus. We are behind schedule, so we try as much as possible to keep it short. Thank you, Prof. Miro, and over to you.
Thank you so much, Max. Today we are talking about a very great opportunity indeed for all of us in agriculture extension and advisory services. And I'm delighted to be presenting on how we can advance nutrition sensitive agriculture in Africa, and certainly focusing on the role of extension. Thank you so much, and great to meet all of you. This is my brief outline, emphasizing the role of this presentation, but also some big concepts and the status of nutrition, the role of nutrition sensitive agriculture, and that one of agriculture extension.
Prof. Miro, I hope we are not losing you. You have two options: to do without a video and only have the slides moving. Also, Slivia, you could be on standby to move the slides so that Dr. Miro can just present. So we've lost him, I think. I think the internet problem. Okay, so try to get this back, but I think we shall, looking at that situation, we can say we just do the slides minus a photo. You can give your introduction, then move without the photo because of the bandwidth. So let's see if he comes back. If he's not, let's, Peter, I think we should introduce Dr. Rashid as, is Dr. Miro back? Oh, yes. Is he getting back? Hello? Okay. Dr. Miro.
Okay, I think, Max, we can be able to introduce Rashid.
Yeah.
Max?
Yeah, I think, ladies and gentlemen, okay, Dr. Miro is back. We now think, Dr. Miro, because of your internet challenges, you do without a video and only have the slides shared. Then you continue. Thank you. Because you will again follow. Just do without a video. Thank you.
And basically, nutrition is a set of nutrients in food and how the body uses them. And now that relates to diet, health, the fact that we have these important nutrients, and also the fact that the lack of the right balance of these nutrients means developing certain health conditions such as malnutrition. How about nutrition sensitive agriculture? This is an approach that seeks, therefore, to maximize agriculture's contribution to nutrition, and also the attempt to overcome those challenges of malnutrition and micronutrient deficiencies. NSA, therefore, emphasizes nutritionally rich foods, dietary diversity, and food fortification as a way of overcoming these challenges. Again, there is an emphasis on targeting poor households, promoting gender equity, providing nutrition education, and linking agriculture to sectors that address other causes of malnutrition, such as education, health, and other social service related sectors. Again, there is a need for us to appreciate the gaps that we're experiencing as far as nutrition is concerned globally and in Africa. We know now that close to 1 billion people consume too few calories. Imagine calories. Again, close to 3 billion do not have sufficient nutrients. That's almost close to a third of the world population. Then 2.5 billion consume too much food, and that's why we end up with a problem called the triple burden of malnutrition, where we see people who are too short for their age, that is stunted, people who are too thin for their height, that is wasted, and people who are overweight, okay? And these conditions have now also been compounded by rising demand for food as a result of population growth, dietary change along with the effects of climate change and other environment problems. Okay. Again, quickly here, in 2020, which was last year, 720 to about 800 million people again faced hunger. Nearly 2.4 billion did not have access to adequate food the same year, and which was an increase of 320 million from the previous year. We must also note that while many of us and even many of the rural people out there desire to have healthy diets, okay, most of these are very costly and are also perpetuated by persistent poverty and income inequality. And again, as you can only imagine, COVID-19 has also compounded these conditions, leading to many kids, millions of them, stunted, wasted, overweight, and Africa has the highest rates of these conditions. So the above gaps can only be addressed by food system improvements, where healthy, diverse foods are accessible, and by all segments in the population. So what's there for the role of nutrition-sensitive agriculture? Agriculture and food systems, as you can guess, impact nutrition, influencing how much, the quality, and the variety that is produced. It can also influence the prices and purchasing power of producers, as well as the food preferences and people have. And therefore, how does AES play a role in addressing these issues of nutrition-sensitive agriculture? It needs to encourage farmers, of course, through the different innovative ways of reaching farmers to engage in increased production of diverse foods, okay, that are useful for human consumption. It also needs to encourage them to identify local and indigenous foods. I heard Mama Kamau talk about increased interest in local foods, pumpkin powder. Personally, right here, I'm in a place where we're producing orange-fleshed puree for bakery and fried food applications. So we want to encourage our producers and other consumers to get involved in this. Also processing, preserving foods that they can have extended shelf life. Again, AES can be involved by encouraging farmers to participate in market access, increase their own income so they can buy a variety of foods for their own consumption. Improved availability of nutrition-dense foods is also an important focus that we can encourage and visible and trust at the marketplace. And it should also play a role in gender equitable decision-making related to agricultural production and income, because as we are aware, those who are most sensitive and more responsive to nutrition are usually the female gender. And yet those who have the power to distribute income in the home tend to lie with the men. So again, extension has a role in that as well, promoting gender equitable involvement. AES can also be involved by requiring increased awareness and understanding of linkages between agriculture, nutrition, and also integrating this in its messages. But as you are aware, there are certain capacity gaps, as I close here, that AES is facing. One of them is the lack of capacity. Even organizational mandates are not very well distributed. We see a greater involvement of civil society or NGOs in promoting nutrition-sensitive agriculture compared to public agencies. That needs to be addressed. It's a broader institutional capacity gap. Lack of female inclusion, as we talked about, their key role in nutrition. Lack of mobility, of course, and accessibility to certain places, as well as systemic challenges between agriculture, nutrition, and other sectors that are important in making success. And so I would like to thank you for listening to me. And my hope is that you are ready to get on board, to think together with the team here about how AES can successfully promote nutrition-sensitive agriculture. Thank you so much. Over to you, Max.
Thank you very much, Dr. Miro, for that very well thought summary presentation, which gives highlights of really the issues around nutrition and the challenge that the extension has in order for us to be able to address the nutrition issues. Therefore, I think the topic is very important in ensuring that nutrition is integrated strongly in whatever we do as extensionists, whatever we do as research, as moving forward. So having said so, we have the single and most humble honor to invite Dr. Rashid Suleiman, who is a very seasoned extensionist. I already told you that he was a chairperson of the GFRAS steering committee for long, but also he's the person who led the development of the capacity learning needs assessment globally. So with a lot of other experience and qualifications that I wouldn't like to get in, because I would try to read another thesis here. So with that humble introduction, we would like to welcome Dr. Rashid to give us a snapshot of the GLA methodology. Over to you, Dr.
Okay, thanks, Max. I hope I'll be having the PPT will be shared from your end. Who is sharing?
Olivia, or if you have yourself, you could actually share them.
I think
it's open. Olivia is doing that. Thank you.
Okay.
Very good.
Be full screen. Okay. So anyway, many thanks for inviting me to this meeting, and I'm also very glad to hear Salim and Mary, my colleagues in the GFRAS. So I think because of the COVID, we have not been meeting and hearing so often. So I think it's very good to listen to both of you. And I want to give you a very brief presentation on this global capacity need assessment methodology, which was developed by FAO and the GFRAS, the Global Forum for Rural Advisory Services, together. And this was pilot tested in 5 countries globally. I think we developed it in 2018, 2019, pilot tested in 2019 in 5 countries, Malawi and Cote d'Ivoire. I think we have both Catherine and Edith with us today. And this was also pilot tested in Tajikistan, India, in one of the states called Telangana. And we have done it in Chile. So 5 countries we have pilot tested it. And this document is currently available. So a lot of information is available about the assessment methodology. But I would like to focus more on how it was developed, why it is important to use this kind of a methodology, and what are the steps in the methodology. This is what I wanted to focus. Next slide, please. I think we heard about, I don't have to repeat what Professor Miro gave in detail, the importance of nutrition and how and why EAS should address nutrition. And I think Mary and Salim also mentioned about it. But the only point I wanted to mention here is that nutrition, there are a lot of organizations are involved in this space in all the countries. Some could be from the health sector, some could be from the nutrition sector, or some could be from the women and child development or rural development sector. So a lot of people have been trying to address nutrition. So nutrition is not a new topic per se, but what is relatively new is that there is an increasing interest in using the potential of agriculture to address nutrition. That is why we have started hearing about nutrition sensitive agriculture. And there is also a realization that no, nutrition is also a big problem among farmers, small farmers, because of many reasons, maybe lack of knowledge, lack of income. So many of them remain poor, and they are also very nutritionally, they are low in terms of the nutrition which they need. And the argument is, since extension advisory services have been working with farmers, so they can really support nutrition. One is through behavioral change communication. You can talk about the importance of nutrition. We can promote diversification of farm income. So there are many ways in which, and even biofortification, helping farmers to grow these type of crops or seeds or varieties which are biofortified. But even though there's a potential, this is not done very effectively, and there are several capacity gaps. And we also learned that it is not merely that our extension agents are not trained in nutrition, because there are bigger issues at the higher level in terms of enabling environment and the organizational level, enabling environment in terms of policies, institutions. We will come to that later. Next. So this whole method, and we developed this methodology. I think this is on the right side. You can see this is downloadable from the web. This global capacity need assessment methodology. And we developed this when we started developing it. We thought maybe let us know a little bit more about nutrition and nutrition sensitive agriculture. So we did a review of these, all these. There's a role of extension in promoting nutrition sensitive agriculture. What are the capacity gaps that are needed, capacity that needs to be addressed. And we also did a review on the learning assessment methods. Initially, it was envisaged as a learning needs assessment. But later on, we realized that no, it is not merely, the problems are not merely at the extension agent level. There are bigger problems, as I said, at the capacities are needed at the enabling environment, at the organizational level also. So we started doing a kind of a review, and this is how we developed this methodology. Next slide. And we thought maybe, finally, this methodology should help people. We should help people. One is, we should be able to really identify the kind of gaps in this whole area. What are and how do we address the gaps, and how do we really mainstream nutrition into extension advisory services? And this methodology should also be of help, to somebody who is recruited to address nutrition, or maybe nutrition or agricultural advisor appointed to address nutrition in the country, and how they should go about. So this is what we focused on, so that it helps people, practitioners, to assess the capacity gaps, but it also helps people to move forward in terms of dealing with this whole issue. Next slide. And so there are three levels of capacity, as I said before. One is the enabling environment level. What are the gaps there? So we thought maybe first we need to, if you are starting to address this issue, we need to understand what is the nutrition context. Is it a problem of undernutrition? Is it a problem of obesity? In some countries, nutrition is a seasonal problem, because during that particular season, there is not enough agriculture, there is not enough other type of occupation. So it happens in certain regions. In some countries, it could be a part of a region, one region which is very poor and underdeveloped, whereas in other regions, it is not there. So we need to diagnose where is the problem. We also need to look at the policies. We need to look at agricultural policies. Are they trying to address nutrition? Or we also need to look at nutrition policies. If it exists, one is the question is whether it exists. Second is, if it exists, is the nutrition policy also give a role for agriculture, or it is only trying to give a, maybe or they have defined nutrition as more as a lactating pregnant woman level problem, or it is a kind of an infant kind of a problem. So how is it really pitched? And are they also, the nutrition policy looks at agriculture also as a method to address nutrition? And we also need to understand, maybe if there's an extension policy, and if the extension policy understands or maybe appreciates the role extension and advisory services should play in addressing nutrition, or it is only focusing only on the kind of a production side, or enhancing productivity, value chain, climate adaptation, and there is no mention about the importance of addressing nutrition. And we also need to understand the stakeholders. As I said before, in all countries which we have seen, nutrition, this is a crowded space. A lot of stakeholders are there. Different departments, ministries, agencies are all trying to address nutrition. It could be maybe supplementary feeding. It could be about vaccination. So it could be about campaigns to promote nutrition. So there could be mass media programs which are trying to address nutrition. So there are several organizations and people are engaged in nutrition. Second aspect is looking at these organizations and trying to understand mandate. I think we also heard about, I think Professor Mira told about the mandate. Because in many cases, when we are talking to organizations, for example, in India, when we talk to the state departments of agriculture, they said, no, there is no mention of, we are not supposed to do anything on nutrition, because our mandate is to increase production and productivity, area development, linking farmers to markets. And then they said, no, nutrition is something you need to talk to other departments, like the Department of Women and Child Development, or you go and talk to the Ministry, the Department of Health. So there could be an issue of mandate. Another is human and financial resources. Sometimes we don't have really because many cases extension itself is very underfunded in many countries. So we might need to look at whether are we simply adding on new functions to extension without really helping them to perform even the existing functions which they are trying to do, enough people, enough resources, and capacity development initiatives. Is there a training program? Is there a training module? Are there training of trainers really trained to promote nutrition sensitive agriculture among extension organizations? Look at partnerships. Are all these organizations in most cases operating independently and there are no partnerships? Are there communication, information, communication, educational materials? What challenges they face? And third level is looking at the individual capacities. So one is the technical capacities related to the knowledge about nutrition. Second is the functional capacities, because you also need to know how to communicate nutrition to people, because it's a behavioral change communication. And what are the other, maybe you may need to organize, mobilize farmers around these kind of themes, help them with nutrition gardens, kitchen. So there are several ways to address nutrition. So I think we need to look at these two levels. So this is the methodology is talking about these two levels of capacity. And also it talks about what are the mechanisms to collect this information related to these aspects. Next slide. So what we did, so we started understanding this in terms of we started doing a quick review of what is available in terms of nutrition policies, programs available. So it's a kind of a review of literature. Then we try to do a kind of stakeholder mapping. So who is involved in nutrition? So we are broadening. We are not merely looking at the agriculture sector and our extension advisory services within agriculture sector. We are looking at the other organizations trying to address nutrition. So the stakeholder mapping. So who is doing what, where, with what resources, and what is their program focus? Is it for some people, as I said, it could be vaccination. Some people it's only about taking care of, or maybe supporting pregnant women's safe delivery, or it could be about supplementary feeding and vaccination. So from a health perspective, sometimes it could be in terms of primary, I think for daycare facilities at the workplaces, and then there is a feeding available at that particular time. So sometimes it could be about diversification, kitchen garden programs. So we wanted to know what all these stakeholders are doing. Second is the organizational capacity assessment, where we identify people, key informant interviews on a checklist. We try to understand what are the issues at the organizational level in terms of why they are not able to address nutrition, or if they are addressing nutrition, what are the challenges which they are facing. And we also did this kind of individual capacity assessment. We talked to the extension agents in terms of are they getting enough training, what are the challenges which they face at that particular level. So then we also have discussions with the communities to understand what are the current mechanisms in which they are given information related to nutrition, who talks to them about nutrition, or nobody is talking to them about nutrition. So I think the methodology these are the ways in which, or the tools and approaches for data collection. So we develop a report at the country level in terms of a capacity gaps analysis, or a capacity GC and a capacity needs assessment. We identify those capacity gaps. Next slide. So I think these are some of the key findings. So we found that extension in most cases do not typically deal with nutrition, because they don't consider that as a priority, and they consider their priorities is on increasing production, because their priority is always about nutrition. Second is there are many other actors, as I said before, and many of them have people at the ground level, though we don't call them as extension workers, but there are community extension agents of other departments and organizations working at the level trying to address nutrition. So we need to understand what role they are playing. And another is, there is a problem of lack of adequate knowledge, skills, or competencies at the EAS level, because they are not being in the training. I think if you look at the graduate level in agriculture, or maybe in the diploma programs, nutrition is not a real kind of a course. Even if there is a course, it is only about understanding the carbohydrate, protein, fat percentage of different foodstuffs, but really not about how extension can address nutrition. But we need to pitch this problem not merely by training people, because there are, as I told before, no, mandate issues, funding, capacity development, training programs, information communication materials, priorities. So these are organizational matters. So we need to understand that, and there is a need to address this. And another is strengthening capacities of everybody. There's no point in trying to only train or develop modules only for our extension workers within the agriculture sector. We can also develop different types of capsule programs, one-day program, maybe half-day program for extension or community level workers working in nutrition, so that when they meet their clients, they are also the same clients which we are also having. So they also provide information on the ways of addressing nutrition through agriculture in terms of consuming different types of different types of nutritious food. And if they have a land, can they mark a section, mark a portion of that for kitchen garden, or maybe can the communities come together and develop a community kitchen garden? So there are so many things which, so we need to look at help not merely extension workers of the Department of Agriculture or the Ministry of Agriculture, but also look at how we can also how we can get the support of other extension type actors of other agencies. Next slide. So this, and then this is the kind of, few lessons from our pilot testing, the methodology, if you really wanted to do it. One is investigating the 3 levels of capacity is important. As I said before, initially the whole discussion when we started at FAO was trying to look at the knowledge, skills, attitude, kind of a assessment of capacities of extension workers. But then over the review, we realized, no, it is not a problem like that. And we are not going to address the issue of nutrition sensitive agriculture only by training our field level extension agencies. And this GCNA is not merely a methodology, it also provides a kind of a rationale for why extension should address nutrition. So this could be used as a learning material, as it can be used for a training material. We were also very ambitious. We were trying to keen to get what is the data on who is investing in extension kind of a thing. We realized that no, it is a big challenge to get that data. It's always it's always useful to get that data, but then many of these data are not easily available currently. But then if we make efforts now, probably no, the days to come, these will be available. And we also realize organizing a policy review sometimes takes more time than we expected, especially in countries where many of this information is not in English, or maybe it is not available in the internet. It can be, so we will have so it means you have to go and visit to organization, talk to people, and maybe sometimes get the hard copies to understand it, make a Xerox copy. So sometimes it takes time, but it's all worth doing it. Maybe the last slide, next one. So I think these are some of the implications. So if you are a practitioner, if you're a practitioner wanted to address it, so maybe some of the potential tips are you need to start with an actor mapping. So if you're an advisor posted for addressing nutrition sensitive agriculture in a country, you may need to start with an actor mapping, understand who is who, do a policy nutrition context. We need to forge partnerships at different levels so that these organizations come together and try to address this kind of a problem than each one trying to address it at their own level in different ways. So we also need to learn about good practices in addressing nutrition. Maybe this is something which we like organize agencies like networks like ASR, our network agriculture extension South Asia. We have been trying to promote blogs and good practices on nutrition sensitive agriculture, especially nutrition sensitive extension, how extension programs are trying to address nutrition. So another is maybe develop working groups with ministries involved in nutrition where agriculture is also a part of it. And we need to strengthen capacities of all stakeholders, not merely extension advisory services. Next one, and I think there is a references. I think, as I said before, this document is available, and there is also a kind of a small brief from FAO. But then there is no dearth of materials on nutrition sensitive extension. A lot of work has gone earlier by the engineers, the USAID integrating gender and nutrition into advisory services, and FAO and even the GFRAS has done even a NELP module. So this is a good time. We have a lot of resources, a lot of kind of materials to support capacity development available. And thank you very much. Next slide. I think that's the end. Okay, thank you.
Thank you so very much, Dr. Rashid, for giving us your time and such a very elaborate presentation on the methodology and the context on how we can be able to always do the assessment of integration of nutrition into extension, and of course, other elements that come with capacity issues. Thank you so very much, and also the links. We cannot thank you more. We cannot thank you enough. So now I wish to bring you a team that really worked closely with you to basically give their perspective briefly, highlighting some few areas that complement how they did it in Malawi and Cote d'Ivoire. So I have this honor to invite Dr. Catherine from Malawi to give her perspective on the same assignment that time in Malawi.
Hello, everybody. Hello.
Hello.
Okay. Yes, I will focus on our experiences in terms of the steps that Rashid highlighted instead of going through everything. So I will talk about what we did in practice. We started with mapping the nutrition and the policy context. And in doing so, we focused on literature review. We began with the literature review. For Malawi, it was not very difficult. It was actually, we did it very quickly because there is a lot of information on nutrition. A number of studies have been done by our National Statistical Office, so there's a lot of data. And also there is a nutrition policy at national level as well as at sectoral level. So the nutrition issues, food insecurity issues are well highlighted. And also especially because in Malawi, these issues are persistent. Malnutrition is on the high side, and also food insecurity, it's an annual thing. So there is a lot of information. However, we found that although there is a lot of information, maybe I can say that the nutrition environment is favorable, policy environment is favorable. It is not matched with the implementation on the ground. Implementation is not properly financed, so there is not much being done or changes being made in terms of malnutrition levels as well as the food security levels. So we started with the literature review, and we did that very quickly. We also conducted key informant interviews with key people in the nutrition departments as well as graduate extension departments. On our team, we didn't have a nutrition expert, so we managed to get a nutrition expert who is like a secretary to the coordinating committee for nutritionists, who was very, very helpful. And I would advise that if we have to do that in our countries, we have to make sure that we have a nutrition expert on our team. This nutrition expert worked with her all the way up to the end, consulting at every step that we had. We did key informant interviews during that nutrition and the food security, nutrition and policy context mapping, especially with the nutrition and the agriculture extension departments. And so we got quite a lot of information in terms of some of the organizations, key organizations that are involved in this area. Yeah, so as we were doing that, we were asking which other organizations should we talk to, and so on and so on. So we managed to have a list of some organizations that we needed to do. In terms of stakeholder mapping, it was easy to get a list of stakeholders that are involved in nutrition, but that list did not give us much information. Most of the information would just say they were involved in nutrition, but what exactly are they doing, what role they are doing, where, that information was not available. So we had to add another step to do a a quick stakeholder mapping online to find out who is doing what in the nutrition in the country. So that was a quick survey with a few questions, I think about 8 or 10 questions, very structured. And so we got that information. A number of organizations, about 4 organizations responded, and it gave us an idea of who is doing what. And it also, it was also an eye-opener to see that there are quite a number of organizations doing nutrition, even in the private sector. So that was useful. And from there, we came up with a questionnaire so that we can interview, do physical interviews with these stakeholders. And to do that, we found that it was hard to get physical interviews with people. As much as they were interested in what we were doing, to get them to be interviewed was a tough one. So we only interviewed about 8 organizations from all that, and which gave us a lot of information, very detailed information on what is happening in their organization from the national level up to the ground level. We also managed to most of the reasons that we are giving for not being available are that they are very busy. And indeed, they are very busy. So we also tried to send questionnaires, not really a questionnaire, I'm talking about an interview guide to them so that maybe they can fill and send it to us. But that too proved very difficult. Only a few organizations were able to send it back. I think the reason is also that they are very busy people. We're dealing with people, heads of departments or heads of sections in nutrition in those organizations. So that proved very difficult as well. In terms of capacity assessment, we were assessing, we focused our assessment on staff, field staff, rather than headquarters staff. Headquarters, I mean, maybe those who are at the helm of the organization. Most of the people.
Sorry to intervene, Catherine, because of the time, we would love to hear what exactly did you discover? What are the key issues on the ground? So now that we've known about the approach, but what are the key issues that came out of the assessment? Thank you.
Okay. I think I said something about the stakeholder mapping, that there are a number of organizations doing extension, and we found out exactly what they are doing. And they are involved in nutrition extension, various areas, and also including fortification and so on. In terms of capacity assessment, we did not assess people who were heading the departments, the nutrition experts. We do not assess them. In our mind, we thought with the qualifications that we are hearing, masters, PhDs, graduates in nutrition, we thought they must be aware of nutrition sensitive agriculture, but we could be wrong, so we didn't assess, but we focused on the field staff, and we found that general nutrition content, they are quite okay. They have had some trainings, although the trainings are not frequent, but they know something about nutrition. But in terms of nutrition agriculture, we found that on the ground, nutrition agriculture is happening, nutrition sensitive agriculture is taking place. Only that these terms, they are not so called as nutrition sensitive agriculture, and they are not aware of what we are talking about. So, and we also found that this term, nutrition sensitive agriculture, especially nutritionists, they were not very happy with the term. They were saying that agriculture is already sensitive and so on and so on. So we discussed quite a lot in terms of that definition. So I think as we are doing this, we need to define exactly what we are talking about and come to an understanding with the people that we are talking about in terms of what we need. In terms of levels, we found that we cannot just have a training on nutrition sensitive agriculture, but really we need to focus on what areas of nutrition sensitive agriculture we want to focus on, because we found that in some areas, the field staff were okay, but in certain areas involving gender, involving climate change and other areas, they were not so much focused. So the assessment is very important. After that, we wrote the report and had a validation workshop. The validation workshop was very important. We got a very useful feedback, which we used to improve the report. One of the issues that people were concerned about was having a statistical representative sample, but we explained that that was not the issue in terms of pilot. But if people are going to do maybe a real study instead of a pilot, maybe that could be thought about.
Okay.
Yeah, I think that's
maybe
all.
Winding up, concluding.
Yeah. Yes, I think. Yeah, I think that's all. Maybe I can answer questions.
Okay.
Thank you.
Thank you so very much. Thank you for that perspective from Malawi. We would like to go to Cote d'Ivoire with Edith. And kindly, Edith, we would like to request that you focus on the key things that came out of the assessment so that we build on some of them as we move forward as a continent in terms of the integration of nutrition into extension. Over to you, Edith.
Thank you, Max. Can you hear me?
Yes, very well.
Yes. Okay. Hello, everybody. Please, could you share my presentation? Okay. Hello, everybody. It's a pleasure for me to present the Global Capacity Needs Assessment made in Côte d'Ivoire. In Côte d'Ivoire, Extension Agriculture Services is a pluralistic system dominated by the National Agency of Rural Development and Commodity Value Chain Organization. And we have an high involvement of private sectors. In 2019, a forum, all AIS actors they create a forum, which is a national platform. Concerning nutrition, we have only 25% of extension workers who have a background in nutrition. Next. The activities on nutrition are conducted programs managed by national or international organizations. And these activities concern awareness raising on nutrition sensitization and training and advice, and also information. They also share information with brochures and posters. Next. How did that address nutrition? Extension advisors work with crop farmers and livestock keepers. and actors, but actors are not always perceived the link between agriculture and nutrition. They have nutrition-specific activities which concern the monitoring and the promotion of children from 0 to 20 months growth, the management of malnutrition, culinary activities, and early childhood development. There are also nutrition-sensitive activities which concern vegetable gardens and small farming. Next. The challenge constraining the performance of EAS in promoting nutrition-sensitive agriculture is that there is insufficient funding. Few advisors have a nutritional program of capacities at individual and organizational levels and food habits. There is also a lack of communication platform, and there is poor institutional collaboration amongst actors. What are the capacity gaps at policy level? Because commitment to nutrition has been translated by several actions, such as the prioritization of malnutrition and food fortification. But this has not led to a tangible reduction of malnutrition because there is a lack of unique multi-sectorial coordination, and malnutrition remains linked to food security. There is also insufficient financial resources, which highlight depends to external financial sector. There is low availability of qualified human resources. There is also social cultural factors and lack of common systems. Next. At organizational level, we can notice that organizations refer to ministries, but the activities were previously specific and not sensitive to nutrition, and there is not always sufficient staff to address nutrition. At individual level, all EAS workers are not trained in nutrition, and nutrition is not included in all the activities programs, and they face to lack of collaboration with ministries in charge to food and to food policies and nutrition, and there is also lack of communication and exchange platform. Next. Why this gap? The government works to federate actions across all sectors and actors, but in practice, most activities take place without a real platform of collaboration and exchange. And ministries used to continue to operate in silo by establishing their own framework and indicator defined in the strategic plans. All sectors are not actively involved before in the planning. And generally, they join only on the implementation phase, monitoring and evaluation, and this poses the problem of accountability. So, a multi-sectoral national nutrition plan was elaborated in the aim to coordinate response from different sectors to sustainably improve the nutritional status of the population and foster more inclusive growth and development. Next. So how do we address this capacity gap at the country level among EAS? Next. At policy level, we have to strengthen capacities for multi-sector coordinated amongst ministries linked by nutrition. And then setting up platforms for all actors for co-coordinated action, allow and committees across the country. Next. At organizational level, they increase both specific and sensitive nutrition activities. They have to increase funds for nutrition and to develop training models and learning materials relevant for capacity development, appropriate to staff, trainer, or actors, and to integrate effectively nutrition training in EAS program. Next. At individual level, you have to participate to communication platform and to establish food diversification program according to regional eating habits, and then also to support farmers and breeders to better apply advice on nutrition given and during training to prevent malnutrition. Next. And all this will be made by partnership. So it is important to collaborate and have partnership because this will help to mobilize experts for capacity development in AIS workers. They also help to access to funds for nutrition implementation and help to develop appropriate policies related to nutrition and awareness of agriculture practices, and also help to establish relationship at national and international levels. Next. How relevant was the methodology? This methodology helped us to map all key categories actors involved in nutrition, agriculture, and EAS. And it also helped to understand the nutritional and agricultural context of Côte d'Ivoire. And this was the methodology was very comprehensive for the evaluation of capacity gaps. But we have some challenges, and one of the challenges was the unavailability of some of the target case informants and resource person. And this methodology was also a little heavy to do because we have to work with two levels of entity at the same time. And this was not really easy. Next. What have we learned with this methodology? This methodology helps us to understand the linkage between nutrition and agriculture at farm and household level, and also to realize that nutrition concept is large and there are already some initiatives and achievements for still at a small scale and with limited synergy and coordination amongst actors. And we learn also that farmers and livestock keepers don't yet fully realize that inadequate nutrition can save life and improve life, and this could be achieved by most of them. And then extension services are still focusing only on few crops. Some critical crops for nutrition are not well considered, like citrus fruits and vegetables. Next. So to strengthen the role of EAS in promoting nutrition security, nutrition sensitive agriculture, we recommend to develop capacities of extension workers and extension organizations on nutrition, to strengthen linkages between extension organizations and ministries in charge in food and nutrition matters, to assess capacity development needs of producers in nutrition, and to mainstream nutrition in all major agricultural and rural development projects and programs. Thank you for your attention.
Thank you very much, Edith. Thank you for that elaborate presentation. And for participants, we shall get all these presentations to you so that you use some of them as your reference documents as we support our countries. Now, I love to hand over the session to my very wonderful brother, Peter, who will guide us in the next and also to talk about the guiding questions and the approach next so that we move quickly to the next segment of our conversation. Over to you, Peter, please.
Thank you very much, Max. And thank you very much, the presenters. You have really given us very good highlights on the issue of nutrition-sensitive agriculture and the role it can play when it comes to the issue of saving lives and really addressing some of the issues which we have. So thank you very much. So I think we have been able to go through the process and we are now clear, and we are very clear with how we are going to move in relation to the activities. So what I would propose, I would want to share something, and I'm sharing what we are going to have within the breakout session, because at this point, we are going to have some breakout sessions, and within our breakout sessions, we are going to be guided by our ICT experts on which teams you will be. And within our teams, we are basically going to have 3 teams. The first one will be dealing on the issue of the policy environment. Remember what Rashid presented. And this one is going to be facilitated by Alice. So we'll be able to have a team. And the other one will be on the organizational issues. And the third one is the level of the individual, or what we are referring to as the practice. So when we go to the breakout session 1, the areas we are going to focus on are a number of them. These ones will be able to look whether there are policies on extension and advisory services, possibly in our respective countries, or basically let's have a framework where we'll be able to look at different areas. But we want to look at whether there are policies on extension and advisory services. And 2, we also look at whether we have policies on nutrition. And then we look at these linkages between these 2 policies, whether they have some nexus. And here we want to see guidelines on integrating nutrition into the extensions. Do they exist? And we also look at status of implementing of the existing policy, whether we are able to conduct audits, monitoring and evaluation, or how the implementation is ongoing, what challenges have been encountered in implementation of these policies. Industry, we give recommendation on opportunities to improve this policy environment, what new policies needs to be developed, and what are the existing policies which needs to be improved and in what aspects. So even if we are from different countries, I'm sure we can be able to give snapshots of some of these issues within the policy environment, which can be able to form basis of our discussion. So that one will be group 1, which will be facilitated by Alice. Then group 2, we are going to have the organizational capacity. And this one, I'm going to facilitate this group. And we'll be looking at the organizations having the mandate of the extension and nutrition clearly defined. Just like we have the experience of Malawi and Cote d'Ivoire, and also India, we want also to see what are the positions. The organizations represent different sectors. Do the organizations have adequate capacities? We need to ask ourselves, and these ones are just snapshots. Adequate personnel with necessary capacities, able to access training and capacity building opportunities, and access to information, and whether they have resources and such things. And are there any model institutions with best practice which we can be able to learn about this nutritional sensitive agriculture? What are the coordinating mechanisms between different organizations? And then this group will also be able to give us a recommendation of opportunities to improve this capacity for organizations. The last one will be 3. These are the practitioners. And here we want to know whether the practitioners have the necessary or basic knowledge in nutrition. Do they have adequate opportunities to improve their capacities and knowledge? What extent do practitioners integrate nutrition into extension and advisory services? What are the sources of information for nutrition at this level? And which organizations do they collaborate with? What good practices do they apply in integrating nutrition information to extension messages? And what challenges are encountered in the day-to-day practice of integrating nutrition into extension service delivery? And you can also be able to recommend how to improve nutrition-sensitive agriculture. So these are some of the key areas we are going to discuss. I am sure they are quite some mouthful. So we are going to employ both chats and also some discussions so that we can be able to enrich as much information as possible. And this group is going to be facilitated by Professor Maina. So we'll be able to look at this. So what we'll be able to do when you'll be taken to our groups, breakout sessions, we'll be able to get Lapotua, and then from there we have the moderator who will be able to really guide through the process, and then we can be able to move to that position. So Max, that is the direction we are going to go. I think you can be able to guide us now on the breakout session. Back to you, Max.
Thank you, Peter. And Kenneth, would you love to do the technical parts of your part? So that you guide the people on how they deal with the breakout. You and Sylvia, please. Just tell us what to do so that we pay very great attention. We kindly, participants, this is a very critical session that your input will really count for the continent. So we need you in the discussion rooms. Over to you, Kenneth and Sylvia.
Sophia?
Yes, I think Kenneth is going to guide us on how we are going to go about this.
Yes, thank you, Sylvia. Good afternoon, everyone. We'll all be required to log off this account for about a minute. Then you rejoin with the same link. And once we rejoin, we will be able to be taken to the individual breakout sessions.
Okay, thank you very much. So we are going to log out, then we log in.
Yeah, just after a minute or two, yeah.
Okay, thank you. So let's log out. Then from there, we'll be able to come back and we'll go to our groups. Thank you.